Before we talk about tomosynthesis, we have to first answer what is a mammogram. So mammogram or mammography is basically an X-ray image of the breast. And conventionally speaking, this is done in two dimensions, like a flat sheet of paper. So X-ray is projected through the anatomy and it exposes a film that generates an image that is two-dimensional, like a flat sheet of paper. Tomosynthesis is an advanced way of doing mammography, and this generates a 3D image. If you've ever bought a home or looked into renting an apartment, typically on the ad, you'll see a two-dimensional bird's eye view or blueprint of that apartment. You can think of that as a conventional mammogram. A 3D mammogram or tomosynthesis, on the other hand, is a three-dimensional way of doing a fly-through, if you will, of the anatomy. So kind of a 3D walkthrough of an apartment or a house or so forth. So it's the advanced way of doing mammography in the cutting edge of mammogram technology. So tomosynthesis, in short, is a 3D way of imaging the breast. It allows us to scan through the anatomy, similar to a CT scan or an MRI, and it's currently the state of the art in the way of imaging the breast. Conventionally speaking, a 2D mammogram is done in like a flat sheet of paper, so you have this phenomenon called superimposition. Because you're looking at a flat image, the anatomy superimposes upon itself and can create the impression of a mass, or worse yet, obscure the presence of a mass. With a 3D mammogram or a tomosynthesis, we can scan progressively through the breast and rid ourselves of that phenomena, the superimposition phenomena, and see things in greater detail and see them essentially in 3 dimensions. One of the other drawbacks of 2D mammograms is that it creates false positive findings, meaning we're seeing things that are not really there. And for that reason, we've historically called a lot of patients back from their screening mammograms for findings that aren't truly within the breast or the anatomy. And 3D mammograms or tomosynthesis allow us to see things in greater detail and get rid of those false positive findings. So we're seeing an improvement in the callback rate for patients with screening mammograms. In addition to that, it has reduced the false negative rate. So that phenomena that I mentioned of superimposition obscuring lesions, we're finding real things that are obscured typically by breast density with 3D mammograms. So that has improved our sensitivity and specificity for diagnosing disease. So breast density exists on a spectrum. Breast density is essentially defined as the amount of fibroglandular tissue within the breast compared to the amount of fat which is in the breast. And these are both anatomic structures that we find normally in the breast. Fibroglandular tissue usually appears as a white and fat is black on an X-ray. And the more fibroglandular tissue that you have, the more dense your breast is. So if you're closer to the dense breast spectrum, 3D tomosynthesis is more beneficial in that setting, relatively speaking, than less dense breast setting. But 3D mammograms benefit everyone across the spectrum, but the degree of benefit is greater in patients with more dense breasts.